So all up, the sites have been selected through a process of looking across the country, urban, rural. The risk matrix was developed by the Department of Health. Every area has to be, we always have to have somewhere that's first and then the whole of the chain. And they have done it on a risk basis for the country, as well as making sure there's diversity across urban and rural and all parts of Australia. And so nobody's missing out. We begin this process in the next week, and that's an immensely important thing. And by definition, if in the first week we're looking at 60,000 doses are actually being administered, then that's the first part of Australia that will have it. It may well be higher than that, but we're working on a basis of getting those out on dose administration.
It's really important to recognise we have no community transmission at the moment, so we have several weeks to safely vaccinate our aged care facilities, and that's what we're planning to do. Clearly, if we had an outbreak, we might change the schedule but there is no impending serious risk at the moment, which is a great position to be in. We've factored in a small proportion of wastage. It depends on the vaccine, and we don't have a set figure at the moment, but we're going to monitor wastage very closely, particularly with those precious early doses.
One thing that we do want is, and the Health Department has been very strong on this, where, for example, there's an extra dose or 2 doses at the end of the day, just practical action that if there are carers or nurses or other people who aren't in the target group but who are present, we don't want them to be wasted. We want to give people the freedom to be practical Australians to make sure that they are able to minimise any wastage.
Just to follow up on the Eden Gardens and the Newmarch issue, was there a consideration of not putting it into places like those homes in the first week because the virus has already been through those homes?
No, there wasn't. We don't yet know. Many of those facilities have new residents who weren't exposed to the virus. That hasn't been a consideration. The consideration has been simply a logistic one. We've got several weeks. We're in a safe position. Let's do it in the most efficient way we can.
Everyone will be covered over the course of 6 weeks. And it wasn't about individual facilities. It was about regions. Last question.
Professor Murphy, could you tell us more about the contingency for using vaccine supply in a potential outbreak? What metrics would be involved? Whose decision would it be? What would trigger it?
It would be AHPPC has advised collectively our governments on whether an outbreak is of significance. So if there were a significant outbreak in a particular part of a city, then we would activate an AHPPC meeting, and if they recommended a ring vaccination process for a group of people or an area, then we would undertake that.
So a few cases, though?
Well, these things, it depends what the cases are. If they're all in household contacts, as they were in the recent Victorian outbreak, it's not so much a risk. If you had 19 community cases, it would be a different circumstance.
So I'll just finish with this. I apologise, I better.
I just have one clarification for Professor Murphy.
Briefly, yes.
Sorry, around Pfizer and AstraZeneca for aged care homes. So Richard Colbeck yesterday indicated, though, that some aged care residents may end up getting AstraZeneca. So can you just clarify?
That was our initial plan, but I think at the moment, and there may be some parts of the country where we may have real difficulty getting the frozen Pfizer to, but our intention at the moment is to try and get Pfizer to every aged care resident if we can. If we can't, AstraZeneca is a very, very good vaccine which protects, and there may have to be some facilities in very difficult areas, but the logistics team is going to try and get them to everywhere.
Can you just explain, sorry.
So I really do have to go for question time.
Will it be defrosted before it's transported, or will it be sort of packed in dry ice? Can you just explain?
Well, it will be defrosted before it's transferred to the aged care facilities and then reconstituted on site. So it lasts in the fridge for 3 or 5 days. In the Pfizer hubs in the states and territories, it will largely be defrosted on the day of administration.
So the final thing is today is the next step in the national vaccination rollout. Now we know where and we know who and we know how. We'll continue to provide more information, but with 0 community cases today, Australia-wide, 0 community cases yesterday, we are in a globally very fortunate position, thanks to the work of Australians. We begin the task of providing more hope and more protection to Australians going forward, and the vaccination rollout will proceed over the coming months, and we ask as many Australians as possible to come forward and to help protect themselves and to protect their families and to protect their communities. Thank you very much. Take care.